Hello guys, today we'll be talking about gonorrhea and I'll be talking about gonorrhea under the following headings: introduction, causative agents, pathogenesis, epidemiology, risk factors, diagnosis, as well as treatment. What is gonorrhea? Gonorrhea is a common sexually transmitted infection that is of great public health importance. It is caused by the bacterium Neisseria gonorrhea. Gonorrhea primarily affects the mucous membrane of the urogenital tract. It also affects the pharynx, the rectum, the conjunctiva, and in advanced cases, it can affect other parts of the body when the bacterium becomes disseminated. Gonorrhea is one of the major causes of reproductive morbidity, particularly in low and middle income countries, due to association with pelvic inflammatory disease, infertility, ectopic pregnancy, and increased susceptibility of the human immunodeficiency virus infection. Despite the availability of effective antimicrobial agents against gonorrhea, the control of gonorrhea remains increasingly challenging due to the emergence of antimicrobial resistant strains of Neisseria gonorrhea. Gonorrhea is often asymptomatic, especially in females, and this leads to delayed diagnosis, transmission, and later complications. Gonorrhea is not just of clinical challenge. It's not just a clinical challenge, but also a significant laboratory, epidemiological, as well as public health concern. Let's talk about the causative agent. The causative agent of gonorrhea is the Neisseria gonorrhea. The causative agent of gonorrhea is the Neisseria gonorrhea. This is a gram-negative organism. It is usually kidney-shaped diplococci that is located intracellularly within polymononuclear leukocytes within clinical samples. It is usually seen as kidney-shaped diplococci. A diplococci is basically two bacteria, two bacteria that are conjoined together, two spherical bacteria conjoined together, and they're usually enclosed within intracellularly within a polymorphonuclear. This is a polymorphonuclear leukocyte. This is a diplococci. This polymorphonuclear leukocyte can be eosinophil, it can be basophil, it can as well be neutrophil. Basically, polymorphonuclear leukocytes are the granulocytes. So this is basically how the Neisseria gonorrhea looks like in clinical samples. Neisseria gonorrhea, of course, is gram-negative and it is non-motile. It is aerobic and campnophilic. Campnophilic in the sense that it thrives in environments with increased carbon dioxide. Also, it ferments glucose and not maltose. This is a distinguishing feature that differentiates Neisseria gonorrhea from its counterpart, Neisseria meningitidis, which has the ability to ferment both glucose and maltose. Neisseria gonorrhea is non-spore forming and it is also non-encapsulating. Neisseria gonorrhea has specific and special virulence factors that it uses to carry out its pathogenicity within the body. These virulence factors include: one, the pili, specifically the fimbriae. The fimbriae, it uses the fimbriae to attach to the mucosa epithelial cells of the host, particularly of the urogenital tract. It also has the outer membrane proteins, particularly porins, as well as OPA proteins. The presence of porins and OPA proteins aids in adhesion of the bacterium Neisseria gonorrhea to the mucosal epithelial cells of the host. It's also the outer membrane proteins also help in invasion of host cells, as well as evasion of the host immune response to the presence of the bacteria. Other virulence factors include lipooligosaccharides. Lipooligosaccharides. Lipooligosaccharides act as an endotoxin, and the presence of the lipooligosaccharides in Neisseria gonorrhea aids in inducing inflammation as well as tissue damage. There's also the presence of IgA protease. IgA protease degrades the secretory IgA, and this aids in enabling survival of the bacteria on mucosal surfaces. Let's talk about the pathogenesis of gonorrhea. Let's briefly talk about the pathogenesis. The pathogenesis of gonorrhea begins with the sexual transmission of Neisseria gonorrhea via contact with infected genital, rectal, as well as oropharyngeal secretions. Vertical transmission also occur from parent to child during vaginal delivery. The bacteria, once in the urogenital tract, attaches to the mucosal epithelial cells of the urogenital tract, the rectum, pharynx, or conjunctiva, as the case may be. This attachment is due to the presence of the pili, fimbriae, or the outer membrane proteins. The attachment is highly specific and it forms the first stage of infection. After attachment, the bacteria then adhere to the mucosal epithelial cells and penetrate into the mucosal epithelial cells, multiplying within the mucosal subepithelial cells. Once multiplication has occurred in the mucosal subepithelial cells, the bacteria releases lipooligosaccharides. Lipooligosaccharides are endotoxins, and because they're endotoxins, they induce a very strong inflammatory response, and this inflammatory response is characterized by neutrophil infiltration. Neutrophils accumulate in the site of infection, and the presence of these neutrophils cause the release of toxic chemicals that neutralize the bacteria. But these chemicals are also toxic to the cells, to the surrounding cells, causing tissue damage. The death of the neutrophils as well as death of bacteria causes formation of pus, and this leads to purulent discharge. In males, the infection leads to urethritis, which is the inflammation of the urethra. In females, the bacteria ascends from the cervix to the fallopian tube and the uterus, and this leads to pelvic inflammatory disease. In some cases, the bacteria can also spread hematogenously, that is through the bloodstream, and it can lead to the formation, it can lead to a condition known as DGI. DGI. DGI is disseminated gonococcal infection, and this can manifest as dermatitis. It can also manifest as endocarditis in advanced cases. So this is basically about the pathogenesis of gonorrhea.